Hi, everybody.
Hello, Good Gut Gang.
Welcome to another Good Gut Live. We're really excited to be here with you today. This was a topic that was on Dahlia's really heart, and she brought this topic up. So we wanted to bring it all to you. For those that aren't familiar with Good Gut Live, this is our Good Gut Live, our time to be live. Many of our members watch, many of just our community in general. You get to ask questions live. And if you're listening to this later, you're listening to a replay, but it probably wasn't too far back on Good Gut Live podcast, which you can find on Apple and Spotify and everywhere you find podcasts. So we're very excited to be here. My name is James Marin. I'm an integrative registered dietitian, environmental nutritionist.
I'm Dahlia Marin, an integrative gut health dietitian. We're both the co-founders of Married to Health. So aside from James and I, you can see the rest of our team at marriedtohealth.com. We have 7 total dietitians on our team, all with our respective passions and focuses. And, you all know mine is gut health. I'm all about guts, butts, poop, all of it. Because we all do it. So that's my area of focus. And that's why we bring you these Good Gut Lives. And this is a topic that I'm asked about very frequently. I hear this from my patient population. It's a frustration point for them. And we just wanted to speak to the research and the data behind why this might happen in various types of SIBO, who might see it happen, and
it is
what it's correlated with.
Weight gain and your gut health, right? And a lot of patients come in, whether they're calling us on the phone or calling our office, of like, I want to lose weight. Who can help me? And then as we dig deeper, and maybe they'll meet with Katie, or they'll meet with Laura, or they'll meet with some of our other dietitians who focus more on the metabolism. Come to find out, oh, I have fatty liver, my gallbladder's not working, and I've had constipation since I was 4, and there's a lot of gut issues going on underlying. And then when kind of they are maybe a SIBO patient, IBS patient, and they're like, you know what, as my gut problems are going away, I'm gaining more weight. What is up with that? So we want to answer some of those questions. We're all about giving context and just really the proper evidence-based answers to this. And then continuing to remind everyone, it's not always about just weight loss, because again, losing weight can mean water weight, it can mean glycogen, it can mean a lot of things. Even your microbes weigh weigh quite a bit. About 7 pounds of microbes live in and on us at any given time. Again, it can vary with size and age, but even your microbes can weigh. So it's not really just about the weight, because you can lose quite a bit of weight. It's healthy body composition over the course of your healthy, sustainable life. So that is the goal. So it's going, okay, healthy, sustainable gut and a healthy, sustainable body composition. What's up with that? What's going on? So we're excited to kind of dive into that topic today.
And if you're here and you're like, what is SIBO? What are they talking about? We encourage you, go back, watch some of our past lives, go back to our YouTube, watch some of our past, because we've talked all about irritable bowel syndrome, a subtype of IBS that's called SIBO, small intestinal bacterial overgrowth, or IMO, or now we have ISO, intestinal sulfur overgrowth. So we've talked all about that. But of course, when you have an overabundance of these gas-producing bugs, they're going to cause symptoms. So we've talked before about how hydrogen producers, a lot of times certain bugs are producing that type of gas, E. coli, methane, and others. When you're producing all this hydrogen gas and you have bloat and diarrhea, that will affect your intake. So we've seen in various studies, for example, there was a really good 2024 observational study, and they kind of just looked at intake of what those with SIBO were eating. And we found that it differed based on the type of gas they were producing. So if those with hydrogen gas have diarrhea and gas and bloating, those with methane overgrowth are constipated, very bloated, more prone to having reflux. But again, constipation is the crux. And then those with hydrogen sulfide also tend to have more of a diarrhea type, urgent type, abdominal pain. They're, of course, finding that less than 50% of those who had methane overgrowth and less than 40% of those who had hydrogen overgrowth even met their carbohydrate needs for the day. And that is very likely because fiber is a carbohydrate. And it's especially found that those with methane overgrowth are not wanting to eat fiber. When you're already constipated, fiber can bulk up your stool even more that you're already constipated with. It's not going anywhere. So it has been documented that those with methane overgrowth are restricting their fiber even more so than those with hydrogen overgrowth because it produces even more bothersome and uncomfortable symptoms for them. So understandably, they're not eating as much fiber. And so when that's the case, they're eating a lot more protein. So they said over 70% in this observational study from 2024, over 70% of patients were eating more protein than recommended, no matter the type of gas that they were producing. We're seeing over 50% of patients had more saturated fat than recommended, which affects the gut lining. And so we're seeing these great variances. So of course, when you go from having to have really adjusted your needs to eating this very high protein, lower calorie diet, because a majority of them, over half of them, didn't even meet their basic caloric needs for the day because of your symptoms when you're adjusting what you're eating because of that. And then hopefully you're eradicating the overgrowth and you're eradicating that dysbiosis, that gut imbalance. And now you don't have to eat to accommodate your gut bugs. So you can eat more carbohydrates. You can eat more healthy fats. You can eat fiber now. So of course, that's going to lead to a little bit of weight gain because now you're just meeting your caloric needs. So it's very likely that they had lost unhealthy weight while they had that malabsorption, while they had that gut imbalance. And we all know, or, those of us who really are experts in SIBO know that SIBO, especially if someone has it for a very prolonged period of time, it will damage the lining of the intestines and especially the small intestine. And that's where we're absorbing nutrients. So if you have that damage there, you naturally will have malabsorption. You're poorly absorbing nutrients. So when that's happening, you're eating less. So that's going to lead to you not weighing how much really your body oftentimes wants you to weigh. And then not only are you eating less, you're not absorbing really efficiently what you're eating. So these are very well documented things that we're seeing.
And to summarize, yeah, so before you know what's going on, you can have, and I want to touch on that point, like Dahlia is saying, malabsorption. Malabsorption's huge, and it can be a major factor for some people, especially we see this also in the elderly population when they have unintentional weight loss, right? So you may think of like your great grandmother or your grandmother who's like so thin and frail, and no matter what she eats, she can't seem to put on weight. It's likely GI distress and GI, I mean, it can be a factor, right? There are many other factors, but this malabsorption is a huge factor where there are even drugs out there that can cause malabsorption. So you can, as a form of weight loss and as a form of that weight kind of and body composition, healthy weight. It's not really healthy weight loss, I would argue, but it's weight loss. So yeah, that malabsorption is huge. So before you know what's going on, it's constipation, it's malabsorption, it's maybe you're inflamed and your enzymes aren't working properly, your gallbladder, and so much is going on where then you're not getting enough calories. So without even realizing you're on a low calorie or a highly restrictive diet, you're not able to absorb these nutrients. So you're like, okay, I'm at a decent body weight, right? After the fact, you realize, oh, it's methane SIBO, it's hydrogen sulfide SIBO, it's this form of IBS-C and, et cetera, et cetera. Then you're going, oh, okay, and you know what to do, or hopefully you're working with an integrative dietitian or gastro that knows what to do. And now your body's able to absorb, wow, okay, I'm eating enough calories, I'm getting everything I need. And then I think the combination with there is you're hopefully getting your energy back, right? You're actually going, oh, wow, I have energy today. And then the goal is some movement and then starting to work with this now healthy caloric intake, healthy absorption, healthy movement, and finding a balance with your healthy body composition now that you have a healthy ecosystem and microbiome inside of you, right? That's all you have to do. It's really easy. Okay, there you go. Everyone knows what to do. Perfect. But yeah, so that's easier said than done, right? Going from I have gut issues to then, okay, I'm fixing my gut issues, getting to the root, everything's great. wonderful, and then going from there. So that can take time. That's a lot of variability. That can be a lot of individualization, because even if you have a methane dominant SIBO, not all methane dominant SIBO is exactly the same. Not every single person is exactly the same. Not, your symptoms are not exactly the same as someone else's symptoms. So there is some variability. Yeah,
Mhm.
perfect.
And
Yeah.
so, like what I said, we're seeing this more so in those with hydrogen dominant SIBO and hydrogen sulfide because they just have more urgent release of what they're
Mhm.
eating. So they're malabsorbing in that way. They tend to have more overgrowth in the small bowel, not always, but, can be. And then, with methane, we actually do see that while someone has methane overgrowth, they can put on weight. So studies do correlate methane overgrowth with weight gain because the methane gas that's produced by these bugs is going to slow down motility.
Mhm.
Therefore, someone's going to have that food available in their system longer, and they're going to absorb more nutrients and more calories to the best of their ability. They could still have
Mhm.
malabsorption, but it's just sitting there longer. So it gives them more of a chance. Whereas when you have diarrhea, your body's just saying, nope, get rid of it, can't deal with it, not today. Um, and then we are also seeing in studies, there's a really good 2020 study that did also correlate methane overgrowth causing fatty liver disease. Um, so we see that depending on the type of gas that you have, it can either cause weight gain while you have the dysbiosis. And if you have methane overgrowth, and we have someone commenting, methane overgrowth here, I gained 25 pounds. So yes, absolutely. While you have that dysbiosis, that imbalance, it can cause it at that time. Or if you have more of a hydrogen overgrowth or a hydrogen sulfide overgrowth, you are very likely going to be catching up because you were not absorbing and we're not digesting those nutrients properly at that time.
Mhm.
And I think this can be frustrating for people because if you've had SIBO for 2 decades, you might have gotten used to being 10 pounds lighter than you are. And so once you heal your gut issues and you're still maybe eating the exact same amount and exercising the same amount, you might notice I'm gaining weight. And it's very normal. Again, your body has been in a deficit for a very long time because it's not just calories that are not being absorbed, it's nutrients as well. We do see in studies that over 70% of SIBO patients have vitamin D deficiency. We also see that their B12 is low. Iron and ferritin, which is iron stores, tend to be low. So it's not just your body trying to catch up on calories and put on body fat, it's the body really trying to absorb those nutrients efficiently as well. So, there's usually an adjustment period where your body's trying to figure out what its set point is again, because our metabolisms and our bodies like to have what's called a set point where we kind of bounce back to that, and then that's your new plateau, if you will.
Mhm.
So during SIBO, pre-SIBO, and post-SIBO might look different for your body. So I always like to remind people of this because it's very common. It's going to happen. And that's why we're studying it. That's why we have all these different studies on it to show it makes sense. There's a reason for it. And this is how we deal with it. And, somebody's asking here, how do you fix malabsorption?
Mm.
And that's a really good question because we're talking about malabsorption causing poor calorie absorption.
Mhm.
And so, first things first, if you have malabsorption, figure out what's causing it because it's not
Mhm.
always SIBO.
Mhm.
Sure, it can be an imbalance of bugs and an overgrowth of bugs where you should be digesting and absorbing in the small intestine. But it could also be something else like celiac disease. We do know that children with celiac disease are oftentimes categorized as failure to thrive
Mhm.
because the autoimmune condition damages those little finger-like projections, those villi that help them absorb nutrients. So it could be celiac disease, which you always want to rule out. You want to also rule out anything else affecting the small intestine, like Crohn's. So really figure out what the root cause of the malabsorption is. Then you want to work on addressing it and moving past it And it might also come with a period of time where you're working on gut barrier support after that. So usually we're working on motility, then we're working on balance, then we're working on fixing that barrier. So that way things can come back to life, hopefully, and then you start
Mhm.
absorbing more and more.
That's what and that's what Dahlia is saying is reminder, and especially for those that have been listening or following us for a while, we are all about test, not guess, right? You
Mm.
really want to start there, and it is working with someone who understands testing. So I think even just backing up further, if you're like, okay, I don't know what I'm doing, I'm confused, this is overwhelming. We get it. We've been doing this for over a decade, and it's still crazy running our practice and our dietitians, and it's a lot of fun and we love it, but we don't expect the average person out there to do that. So we totally get it. And it is asking whoever you find, whether it's with us or whether it's someone else, or there's functional doctors, even chiropractors, and
Mm.
so many people out there that claim, well, they claim, hey, I'm an IBS SIBO gut health expert, right? So it's
Yeah.
asking them, hey, what's your go-to testing?
Mm.
How do you interpret that testing? It's asking these questions. And if they don't know, then it's likely they're not going to be able to help you test and not guess. Or, and what we hear a lot from patients, and we say this a lot because it happens a lot, you go to a provider that is unsure, they just throw the whole shotgun of tests at you,
Mhm.
and you spend upwards of $1,000, and then you still have no answers because they really can't interpret it, or they think they are, and they're just putting you on a basic protocol that doesn't really work, right? So there's all these scenarios, and this isn't to put anyone down, but it's to share what we see, what we hear, and what happens with our patients with you all. And so yeah, that could be a good, I guess, interview for your providers going, hey, what testing do you do and how do you interpret that testing? That's a great interview question for whoever you're adding on to your care team,
Mm.
so they can help you properly. And then, like Dahlia is saying, they're able to understand, oh, you do have this leakiness. Oh, gut permeability is there. Oh, you're lacking in these
Short chain fatty
microbes, short chain
acids.
fatty, and we're able to see, oh, you're really low in D, or your thyroid is not optimal. And there's so many clues that can hone us in on some major root causes that are going to help in this process. So
Mhm.
very, very important. I see some more questions
Yeah,
coming in.
this is a good one.
Yeah. How do you know which type of gas dominance someone has? That is perfect.
Mm.
Exactly. How do you know? Because someone can say, you know what, this doctor told me I have SIBO. Well, okay, we look at symptoms. You can do what's called a breath test, and there is a great breath test. And if you want, comment down below, just say breath test, and we will send you a link to that if you want to know what breath test we recommend. And so, yeah, with that, there's ways to test. So what's really cool is everything that's going on in our body, for the most part, this aerobic reactions. If you go back to high school or college, where you're learning about anaerobic and aerobic chemical reactions and biochemistry, it produces gas. So for every action, there's a reaction, right? And you can produce solids, liquids, or gas, right? Going back to chemistry, our body is this beautiful collection of chemical reactions. And so as I'm breathing to stay alive, I'm not just expelling carbon dioxide. We seem to think, oh, it's just carbon dioxide. No, there's methane and sulfur and hydrogen and carbon dioxide and all these other beautiful gases that are coming from our digestion, as well as in our blood and our lungs and our brain, all over our body. And so we can test those gases. When you're producing an overabundance of a certain gas, it clues us in on what's happening in your body. So this is amazing technology and research that has gone into this, and it really is helpful. I mean, you can speak to it more on just how, I mean, it's helped hundreds, if not thousands, of our patients
Mhm.
identify and understand what's going on in their gut so that you can take the appropriate approach. So,
And, someone's asking a good question of what
mhm,
happens when you have methane and hydrogen. So say you do the breath test
yeah.
and it comes back positive for those two, because the breath test we use is a 3-gas test. So
Mhm,
say you come back with both hydrogen and methane. What I tend to find is these people tend to be harder to diagnose, because if you have enough of each of them, they almost
mm,
balance one another out,
yeah.
because hydrogen causes diarrhea and methane causes constipation. So a lot of the times people don't even know they have SIBO. They're like, yeah, I'm kind of gassy and bloated. And that's it. Their bowel movements are normal. They're like, nope, I go every day. It's a nice type 4, feels complete. And actually, once we start intervening, there's a period of time where things get uncomfortable because it's usually easier to get rid of hydrogen gas producers. They're usually the first to go once you either work with your care team to go on antibiotics or you use herbs. Those are the first to go. The methane producers are very stubborn. So someone goes from I'm pooping every day and it feels great and I'm fine, just a little gassy and bloated, to what the heck? Now I'm constipated. Now I have more methane than hydrogen. You always had that methane. They were always there. They were just being balanced out. So there's an adjustment period where we first address the hydrogen producers, hopefully, and the methane producers. Hopefully, you're going for that double whammy effect. But usually, the methane needs a little bit more intervention, but not impossible. It can just sometimes take longer. But that's a really good question. And I
Very
love,
good.
our friend Stacy's commenting. It's so multifaceted, but it's worth the time and the energy it takes,
Hmm.
to really work on malabsorption, to really work on the dysbiosis, to really work on these gut imbalances that one can have.
But what's beautiful is that, I mean, it sounds like you're just working on one area. Oh, it's just my gut. Like, oh, it's so much work. But the beauty in this, I can't stress this enough, is that when you're working in this one area, it ripples out to so many other areas in your life without even realizing. If you're having issues with mental health, if you're having issues with your skin or sexual health or spiritual health, even, this ripples out. Your gut is the epicenter of so much, because really it's whatever your goal is, right? I mean, if your gut isn't feeling well, if you're not feeling well, if you don't have the energy, it's hard to be productive at work. It's hard to be productive with your kids and with your spouse, or you name
Have a
it,
consistent workout routine when you're just not feeling
when
well.
you're just not feeling well. So this, yes, it can be a lot. And I do say, like, to really dig in and get to the root, you will put in work. An analogy we've used in the past is like, if you want to go hiking and do a really hardcore climb, or like anyone doing Mount Everest or Kilimanjaro, you need a guide, right? And so this is the care team you hire as like a guide, but they're not putting you on their back and hiking for you. They're hiking with you, right?
Mhm.
They're saying, hey, we've been down this path before, hundreds if not thousands of times. We know all the tips and tricks and gear and everything you need. We're going to get you there safely and efficiently, and that's the goal. But you're getting there. You're putting in the time and effort to get the right size hat and shoe. You're putting in the time and effort to put one step in front of the other and climb, or train to prepare to climb and do it. But once you do
Mhm.
it, you're like, man, I'm a whole different person than when I started, right? Oh, this view is beautiful. I can see things so much clearly, or so much more clear. And so it's a great analogy to your life, right? You get your head kind of out of the place you were, and you find this new level to your life, and you're going like, oh wow, the view is nice up here. I like this a lot. And make no mistake, Dahlia and I are doing the same thing in our lives as we continue to grow and heal and build, and find out, oh yeah, that hole in my heart is a lot bigger than I thought, and oh yeah, I'm healing that, and I'm figuring this out. It's thanks to the fact that I became healthy, Dahlia became healthy, that we can help each other become healthier and unlock new levels of our health. So there's always hope. There's always so much more that you can unlock in your mind, body, spirit. And it's amazing. That's part of the fun, in a way, even though it can feel
Mm,
hard sometimes,
doesn't
for
always
sure.
feel
It
fun.
doesn't always feel fun, but it's totally worth it.
And it gives you peace at least to understand, okay, this is normal. Because, I love
Mhm.
it. We have people in our community here in the chat who are kind of commiserating with each other and really empathizing with each other, of both having experienced their body composition changing because they had methane overgrowth. And
Mhm.
so, it's always nice to also have this information so you can say, okay, there's a reason that
Mhm.
this was going on, and I don't maybe I don't wanna be here, but I am, and I understand it, and, we'll continue to come up with that game plan to really work back. But, we're so thankful for so many of you, and, thankful for these great questions that you're asking and your great participation.
I love this one. This one actually goes really well with where we're headed. But hello, can SIBO affect all ages, or is it one age group more likely to have it? And yeah,
Mm,
actually, a 2020 study found that children with SIBO had a weight height deficit, and it is likely related to this malabsorption. So we are seeing kids, and we hear this, we see this, and we read this, that more and more children are having GI problems, right?
mhm,
And so it can be SIBO, which is an overgrowth, can be a dysbiosis, it can be um, basically post-infectious IBS, so coming from food poisoning, or I mean, depending on the age of a child, it's fairly normal for them to be dirty and messy and putting things in their mouth and eating things. Our daughter to this day is 9 and she still does gross things. So kids are building their immune system, but we have to understand our children are building their gut foundation on our gut foundation.
mhm.
And we are seeing this generation after generation, this weakening of the gut microbiome. And again, you can think of it as an ecosystem being cut down, right? We're losing species in this ecosystem as we disinfect more antibiotics, more medications. We're not outside. We're in our home, in our car, in our office. We are losing touch with those microbial species in our food, in our environment, and
Mhm.
that kind of compounds to the next generation.
Yeah,
On top of the fact of our food, I mean, there's so many, we can go into
so
this
many
forever,
factors.
so many factors, but yes, overall. But I would say more so it's affecting females.
Mhm.
So if you're a female child, and then likely though, or I mean, we just have, I would say, more data on the fact of women between the ages of, what would you say, 18
Mm. Yeah,
to
like
60,
20 to 60 usually
20
is
to
the
60.
biggest age group that SIBO is going to affect. But yes, I do see pediatric patients. I have
Yeah.
seen pediatric patients with both hydrogen overgrowth, methane overgrowth, a combination. And like James said, so
Mhm.
multifactorial. But probably one of the biggest factors I've seen in my patients who have SIBO is that food poisoning.
Yeah, it's a
Um,
big one.
or, with methane overgrowth, especially, my pediatric patients who have it tend to have their moms tell me, oh, she's been constipated or he's been
Mm,
constipated from the womb. Since day one, this child was
mhm,
constipated. And it just continues from there to then maybe they're 7, 8, 9 years old and they have fatty liver disease because of the SIBO. 'Cause so frequently, we're going over the child's activities, the child's intake, and it's not necessarily indicative of fatty liver disease typically,
mhm,
but more caused by that methane overgrowth.
mm,
So many factors there. But yes, it can affect children, it can affect adults. Like James said, I think adults are more in touch with their bodies. And so they're more
mhm,
likely to be the ones to say, hey, something's wrong. Sometimes with kids, we just think, oh, they're just a gassy kid. Just don't even worry about it. Or, mom and dad might not
mhm,
be as clued in, or caregivers might not be as clued in to the fact that maybe their distension is very abnormal, or, yeah, maybe their diarrhea is not something the child's telling them. Because at a certain age, you're not taking care of them in the restroom. They're going in there by themselves. So, and I encourage you, if you have small children, especially, have these conversations. It's definitely
mhm.
something we talk about a lot in our home because we both are talking about this day in and day out.
Yep.
But, it's something our daughter will just divulge to us like, hey guys, I had a my stool was off. I had a type 5 today. Or, if she's going through a growth spurt, time is off. Like we all know, okay, dinner time, Layla's going to go right when we finish eating dinner. But have
Oh
these
man.
conversations with your
Yeah.
kids. Maybe show them the kids' Bristol stool chart and just kind of ask them, because it's also very frequent that I'm speaking to a mother or caregiver of a
Mhm,
pediatric patient and they don't know because they're not having these conversations of, what does your poop look like? Does it feel like you got all the poop out? Does your tummy hurt? Uh, You know, are
mhm,
you feeling like it's really stinky when you go, or
mhm.
do you go every day? So we encourage you, ask your kids these questions because they might have SIBO and you might just not know it.
I have to tell you guys how hyper vigilant we are too. Like I know this is we love this stuff, and I recommend you all do this. But when we smell our daughter's farts, we're so in tune that we can tell. Like, hey, you were at camp. What were you eating there? And she's a 9-year-old kid, right? And there's candies and there's all these things kids are bringing, and we can tell when she kind of deviates from her normal routine and her diet, her bowels are kind of making those gases and shifting, and her microbes probably like, what the heck is this candy or this little thing she tried? And okay, all hands on deck, and they're like digesting it and moving it around. And so when she passes gas, we're going like, that doesn't smell like the usual. And so all these things our body does clues us in on like, oh, something's changing, something's off. And then I really, I mean, for those parents out there listening, really, I mean, if you remember when your child was an infant and those sleep regressions, those times of like hyper growth, that doesn't stop now that they're older, right? Whether they're 6, 7, 8, 9, 10, through puberty, even, I mean, even through their late teens, right? They're still going through hyper growth. And at times that hyper growth is elevated, right? At times they're still going through these kind of regressions, quote unquote. And our daughter definitely at the age of 9, I mean, she's missing like half her teeth, and all these new teeth are coming in. Her gums are inflamed because all these new teeth. And yeah, we can totally tell her hormones are surging. She's growing, gas is off, and the poops are off, and you tend to freak out like, oh my gosh, they're not eating, or oh no, but once you kind of understand what's going on, you're like, oh, this is normal and this is great, and we're going to support this and help this. And the same is true for any and all of you going through this and oh, my body's changing, my weight's changing, what's going on. But once you're educated, okay, this is part of the process. Let me continue and be diligent and in my action plan, because I have this understanding, because I'm working with a great team. So all that comes full circle.
Yeah. And someone asked a good question as well of, how do you support your body while it heals from SIBO and you start to gain weight? Is there something we can do to prevent a big amount of weight gain? I think
great question.
It's great for anyone who's conscious of what's going on with their body composition to understand what your body composition is made of. So if you have a body composition scale, if you can access one, I think that's good to know while you have SIBO, as you're healing from SIBO, because maybe you're gaining weight and maybe it's muscle mass that you couldn't put on before. Because they do find that with gas production, whether it's hydrogen or methane, there's decreased muscle mass. So that you're not freaking out off the bat, understand what you're gaining. Maybe it's just water weight you're putting back on because you're eating more carbohydrates and those are going to pull water in with them. Maybe it's muscle mass. Maybe it is body fat. But again, it's one of those things, measure, don't guess, and just look at the number on the scale and freak out and say, I've
test,
gained
not
weight.
Guess. What are you saying?
This is different. We're measuring. So, I encourage you to do that if you can, if it's accessible to you, measure your body composition while it's happening and just understand what you're gaining. And if it is body fat, work with a dietitian, work with a trainer to adjust what your intake looks like. You might need to play around with your macros a little bit, change up your workouts a little bit, because maybe what you were eating or what you were doing while you had SIBO isn't what's best for now, your full absorptive capacity. So have more information and that can help you really understand that.
Can I add to that really quickly?
Yeah.
And also it's what your expectations are of your body. Like I have to say, buddies of mine are watching the new movie, like a Deadpool Wolverine, and everyone's talking about Hugh Jackman in that. He's like 50 something. I think that's why everyone's talking about that. And he's like ripped beyond belief with like an 8-pack and just, I think there's a scene in there where he's just ripped, right? I haven't seen the movie yet. You guys can let me know in the comments down below if you've seen it. But it's like, man, yeah, part of me is like, this dude's 50 something and looks like that. Man, and you look at your body in the mirror, you're like, man, you're comparing to that. And we tend to do that because that is what we'll see in movies and in media and on social media. But it's like, what is realistic, right? And when you come to realize, and knowing what we know and being in the field we're in, that is not a sustainable body, right? It's not even sustainable for Hugh Jackman if he was 20 something, right? So yes, there are some genetic freaks out there, but for the average person, that is not a sustainable body. So what your goal is, what your objectives are with your body, it's very important that they're realistic for your life, for your body type. And like Dahlia said, to measure, not guess, and to understand what your body's going through. And that's also a great point.
Because remember, with these actors or models, especially, or, people you're following on social media, it's their job to look that way.
Yeah.
So they spend hours a day exercising, weighing their food, meal prepping, or having meals prepped for them. If you have a job on top of that, you have a family to take care of on top of that, it's not realistic for you to expect it to also be your job to have an unhealthy body composition, or unrealistic to maintain body composition.
Yeah.
So, always keep that in mind as well.
And I'm seeing the breath test comments. We are noting that. So again, if you're watching this after, you'll also see the link for the breath test in the section below. So yes. Next question, we're seeing what causes strep overgrowth in the colon. Isn't that a throat bacteria? Yeah. Streptococcus aureus, aka
Different
strep
type.
throat. There's different types, guys. This was
Mhm.
really cool. Is that yes, they live in your throat. They're strep on your skin. We posted this recently on Threads of like really, there are no like per se bad microbes, right? Yes, there are microbes that can elicit bad actions in certain concentrations, and when they get the chance, they're opportunistic, right? So if you're creating an environment where lots of strep is building in your throat and your immune system is low and you're maybe low on vitamin D and vitamin C and zinc, and the list can go on and on and on, then that strep's going to go party time, and they start to have a party, right? And then your throat hurts, you feel sick, strep throat, right? But in general, strep lives on our skin, strep lives in our mucosal lining from our mouth all the way down into our gut. So it is like, yeah, what causes strep overgrowth? So in the colon. And so that can be a number of reasons, but if
If it's in your mouth, that's part of your GI tract.
right,
So frequently, people do stool tests and they're like, how did that get there in my stool?
strep is in my colon. Oh no.
If it's in your mouth, you're going to swallow it down. It's going to go
Yeah.
into your colon. But I think with these stool tests as well, they don't always differentiate the type, because there's 4 main types of strep: A, B, C, and G. And they don't always give you a virulence factor. So it could be
Mhm.
dead strep that just got picked up because, yeah, maybe it is a regular part of your flora and then it just died and it tested positive in your poop. So it doesn't always give you a virulence factor. Sometimes it does, to tell you if it's active and actually harmful.
Mhm.
And then again, it's, how did it overgrow in the first place?
Mhm.
I see this sometimes when I order stool tests for my patients. They'll have high strep and high staph. Oftentimes they'll have one or the other or both that are high, but usually because it's a virus, it once you have it, or I'm sorry, strep is a bacteria. But a lot of times once you have it, they're really good at making biofilms, these little protective coatings around them. And they'll just kind of hang around there and they'll just stay around. So most of my patients who test positive for strep in their stool tell me, "Oh yeah, I used to always get ear infections, which oftentimes are strep, or throat infections or tonsil infections." So that doesn't mean that your body completely cleared it out. It could have been that they created a little colony in your behind your tonsil that will kind of come out and flourish when the opportunities are just right. And we do know, because of the types of gases that strep produce, or the conditions that they create, they tend to de-acidify the environment of the gut. And so because they're an opportunist, they'll bring in other opportunists with them. So if somebody has recurrent yeast, sometimes they'll also concomitantly or concurrently have strep or staph, or one of these other ones that allows the environment to be appropriate for the other one to grow. So again, it could be normal, and it could just be inactive strep that you have. If you have it in your throat, or if you recently had a strep infection and then you took a stool test, it could be remnants of that. Or you could just have strep overgrowth that you
Mhm.
have had unaddressed for a really long time. So you want to ask yourself those questions.
I want you to think of it like any type of animal documentary you watch where you're seeing these symbiotic relationships form with the animals, right? That's also happening in our gut, in our from our mouth to our anus. It's not always just strep, like Dahlia's saying. There's symbiotic relationships. They're going, oh, you're an opportunist, I'm an opportunist. Let's team up, right? And they will go to work together. So It's just, again, the higher concentration is usually a strep. That's what you're seeing in the stool test or in the testing going on. But yeah, great
Mhm.
questions.
Yeah. These two
Um,
questions are kind of related to one another.
okay, so hi, having SIBO for 8 years now, would you say it could cause rheumatoid arthritis? Plus, white coating
Mhm.
on tongue getting worse. How do you test for SIFO, which is small intestinal fungal overgrowth? That's what SIFO stands for. Do you want me to read this other question?
No, we can
Um,
address those
okay.
first. First part of the question, could it cause rheumatoid arthritis? Yes.
Yes.
There are specific bugs that are associated with rheumatoid arthritis, but
Mhm.
a large subset of autoimmune diseases are caused by gut dysbiosis and a leaky or permeable gut that
Mhm.
enables these bugs now to roam into the bloodstream and activate the immune system or hyperactivate it to the point where
Mhm.
you start attacking different parts of your body, like your joints or the thyroid in some cases, or the
Mhm.
intestines themselves. So 100% yes, it can be a cause for rheumatoid arthritis. Um, and as far as that fungal overgrowth, that intestinal fungal overgrowth, how you test for it is usually either a culture, if you have a gastro who can do that and culture
Mhm.
your small intestinal fluid to check if there's fungal overgrowth there, or you can also do a urine metabolite test. So, an organic acid test will give you an idea of if the fungi are there because they produce certain byproducts. They produce what's called certain metabolites. So, if there was no fungal overgrowth, they wouldn't have those metabolites present. I like to use a very specific test, and this test shows you if you have D-arabinitol production, and that is one of the byproducts of that fungal overgrowth. But that white
Mhm.
coating on the tongue can certainly indicate fungal overgrowth, especially if you can brush it off and it comes back after you eat. Usually that's an indication of fungal overgrowth. And again, if it's in the mouth, it's very likely in the gut because you're swallowing that down. So,
Mhm.
fungal overgrowth symptoms, and let us know if you want us to do a whole talk all about fungal overgrowth, but just
Whole talk on
really
fungus.
quickly, a lot of my fungal overgrowth patients, because it's very drying and inflaming, they will have reflux, but not regular reflux. They say it feels like trapped gas in their chest that they have to kind of pat out. They have
Mhm.
constipation, very dry stool. Sometimes they'll see little white specks in their stool that look like sesame seeds or small pieces of rice or nuts that didn't get completely broken down.
What about yeast
um,
infections?
Vaginal yeast infections or fungal overgrowth on the skin. So we've seen that very commonly, either of the two. So it's really important to really understand what are the signs and then how can I get tested for it.
What more proof do you need that you're a walking ecosystem? You're literally getting fungus growing in and on you. It's very cool, but not cool if you're imbalanced and having overgrowth. But that's what we're here to do, is help you with that.
Mhm.
Um, I'm going to read this one. When they say LIBO causes a white tongue,
Large intestinal bacterial
does it
overgrowth.
mean it's actually bacteria in the tongue or irradiation slash mimic? Do you know that?
So when they say large intestinal bacterial overgrowth causes a white tongue, usually that's fungi specifically. It's usually not bacterial that's going to cause that white tongue. It's usually more fungal. And again, if it's in the gut, it can
Hmm,
be in the mouth, or vice versa. If it's in the mouth, it can be in the gut.
okay. Which SIBO gas did you say was linked with NAFL?
So non-alcoholic fatty liver, and I think they're calling it something different now. I think it's like MALF. They've changed the name for it,
We're
but
gonna stick
it's
to the.
methane overgrowth. So if somebody has methane
Mhm.
overgrowth, they're more likely to have elevated liver enzymes.
How do you cure hydrogen SIBO?
We've
We've
talked about that
done.
one.
Go back,
So
guys.
yes.
Follow Good Gut Live. Go to marriedtohealth.com. Married to Health um, YouTube. We've talked about that. We you can also check out our Good Gut SIBO IBS program, which is there to help you get to the root of hydrogen SIBO for sure. We've been doing this a long time.
Mhm.
Do you have a scale you recommend?
A body composition scale. Yeah, actually,
Yeah,
I do.
actually, you do.
I would say my top three are the Fit Track scale, pretty affordable. Omron is another one that you can have at home, pretty affordable.
Mm.
in body is like high quality, semi
Oh, yeah.
affordable for home, but more accurate than the other two. But any of those, in body, Omron, or Fit Track. So Fit Track, Omron, or in body are kind of our three go-tos, and ones we've personally used in different capacities. It was nice when I worked in an office and we had
That
like
had
the
an in-body.
$15,000 in body machine that gave you all kinds of information, but the at-home ones are also pretty good.
Mm-hmm.
Yeah, and we'll answer a
Same.
couple more questions. If someone has candida, is it kind of assumed that they would have SIFO? It just depends where they have that candida overgrowth. Again, is it vaginal candida? Is it oral candida? But it depends because, for example, bile is very antifungal, and so is stomach acid. So not always. Sometimes it will be stopped. If somebody has oral candida, it won't always make its way into the intestines fully because the acid in the stomach can degrade it and kill it. And then the bile that flows from the gallbladder that's made in the liver is also supposed to be very antimicrobial. It's a natural antimicrobial. Both of them should be. But we do know there are many instances like hypothyroidism or gallbladder dysfunction or fatty liver where those digestive juices are not optimal. So I've seen it where it might not reach there. But for the most part, we tend to see it in both places because if it had the opportunity to overgrow in the mouth, you want to wonder where it came from. But there are other things that increase risk for oral candida where it's not always in the gut. Like those who use steroid inhalers are at higher risk for oral candida because those steroids promote the growth of fungi. So that would be one risk factor in which maybe it's in the mouth, but it's not in the gut. If that person has proper hydrochloric acid from the stomach and then bile production.
Thorough as always. Should we do this? And can we have just a touch of SIBO, just a little bit of SIBO?
Yeah, totally. Yeah.
Yeah, so base that overgrowth where it's not, and yeah, it's a spectrum. Like even within every layer you dive into, there's a spectrum for sure. Like we've had patients who have such severe overgrowth, their symptoms are that in which it has left them disabled and basically bedridden in some cases. And then we have some who are functioning and working and going about, but it's like, I'm uncomfortable, like something's not right, right? And yeah, there's a large spectrum of SIBO.
Mm-hmm. And usually if it's just a touch of methane overgrowth, try to work on that constipation. And sometimes that just takes care of it. And then it's normal levels. But yes, there are large variances in how much SIBO one can have, which is why it's also important to test, not guess. Because then if you have a lot, if your numbers are 4, 5, 6 times higher than they should be, and you're disappointed that one round of antibiotics or antimicrobials didn't clear it, you might not have realistic expectations for your level of SIBO.
Mm-hmm. Okay. Do you want to?
Yeah, we can answer a few more of these.
Okay.
I love it. Someone saying, thank you for normalizing poop talk. Always. We all poop. We need to talk about it because when we don't, then people suffer in silence. And we don't want that. We need to talk about our poop. It's normal.
Well, shout out Courtney and Trish. They're
Yes.
our number one fans.
We love
you
Courtney
guys.
and Trish in our community.
And then you let me know. Just
do you know if strep is in those pockets in the throat that contain tonsil stones? There has been strep found in tonsil stones, but it can be a multitude of different types of bacteria, but it's certainly possible. Absolutely. And if you don't know what tonsil stones are, that's great. If you know what if you know, you know. If you've ever had one, they're these little stones that accumulate either in the tonsils or if you've had your tonsils removed where the tonsils used to be, but they're usually a buildup of calcium and bacteria. So it can be staph, can be strep, it can be different types of normal bacteria that's in your mouth. But yes, studies have implicated strep as one of the possible bacterias.
I think mouth breathers are more prone as well. There's been some studies on that. So if you're getting lots of tonsil stones or you have typically you have tonsil, adenoid, You have all these, sinus and, your mouth breather. That could be a whole nother talk, but yeah.
Mm-hmm.
Okay.
Absolutely.
Love it. Seeing
Okay.
some of the great comments. It's great reading through all your comments.
Yes.
We love this. We love kind of touching on a topic. Again, we're just hitting the surface, and also as disclaimers, as you maybe have seen or already heard, this is not specific medical advice. It's just general recommendations and knowledge. But please feel free to share this, to tag someone below, to comment below. Links will be below if you're watching this later. And you want more info on testing, on working with one of our dietitians, on working with Dahlia, that's all down below, and you can find that at marythealth.com. We hope you enjoyed this topic of just understanding healthy body composition as it relates to your healthy gut microbiome. That is what we're all about.
Mhm.
Stay tuned, guys. Make sure you're going to marythealth.com, getting on our newsletter, or even you can just send us an email if you click on contact to get added to our email list. We are gearing up for some in-person events next year, or I should say one big one on a farm. If you're interested to be on a regenerative farm, learning about gut health practical. It's not just like theoretical, do this and do that and good luck. We don't know how we're going to help you. We want to help you with practical tips, with practical knowledge, and we're excited. We're putting a lot of these great pieces together. So if that excites you, and just learning more about nutrition, from farming to fermenting to natural home building, or what's in your home, everything that practically relates to your gut microbiome, we want to hit on. So we're excited about that. So if you want to learn more, marythealth.com. And as always,
Heal with each meal.
heal with each
We
meal.
hope you all have a great